welcome back to the Oral Health Podcast. So, as I said last week, today we're talking about the role of a dental nurse. Karen, you are with me again. You've got lots of experience as a dental nurse and working as a dental nurse and in dentistry for ages. So
you're aging me again now, Sophie.
I was really trying to watch my words because I know last time I said you've worked in it for many, many years and you went, I'm not that old. So I was trying to be a bit more polite about it.
You're getting there then.
A long time you've worked as a dental nurse and done dental stuff. So for International Nurses Day, I just wanted to sit with you and have a chat really about what it means to be a dental nurse, because it's a lesser known part of the dental team, I think.
Yeah, it is. I mean, it's a role that is absolutely necessary for the smooth running of a dental practice. A dentist can't work without a nurse. Mm-hmm. But it used to be, when I first started, you were kind of like the silent person in there, and it was, you know, you're handing things to the dentist, you're using the suction, etc. But you know, the role is what you make it, and I always think that one of the major roles of the dental nurse is being almost that buffer between the patient and the dentist. You're kind of like no man's land in the middle, so you're much better placed to be looking after the patient. So I think it's a really sort of patient-focused role. So you're the one that 9 times out of 10 will go and get the patient from the waiting room. So you're taking them into the surgery, you're reassuring them as you're going, and you know, you're finding out any kind of worries that they might have, etc. And you know, you can build up that rapport with a patient if you know they're sort of a regular patient with you, and they kind of, they know that they've got you as their support. And you know, the times you sit there and you know somebody's a bit nervous, you know, you sit and hold their hand while you're working, because it reassures them. And you know, I think that that's a nice thing, because they do see the dentist as the man in the so-called white coat, and the dental nurse is supporting both the dentist and the patient. And I think that's a really important thing, that we are there for the patient, really. And obviously there are you know, important treatment roles that we're doing. So we are looking at taking the notes. So we have to write out the full notes, making sure that everything is on that patient's record card or on the computer. So we're charting everything that the dentist is seeing on the checkup. So that's instruments have to be ready, decontaminated if you have a decontamination room. Obviously it's done by somebody else, but not many people have that luxury of having a designated decontamination person. So you're cleaning the instruments, you're washing them, you're sterilising them, so you're bagging them, sterilising them, you're dating them, then you're putting them away after that process. So, and there are different trays for different treatments. So a filling tray will be different to an extraction tray, etc. So you are basically pre-planning and looking ahead for what your dentist needs before they even ask for it. Mm-hmm. So your chair side, you are aspirating, which is the tube that you use to remove the water that's being sprayed. So when a dentist is doing a filling, they have a high-speed drill. Now that drill is going so fast it would burn. Mm-hmm. So water is sprayed onto that drill as they're using it. So there's a lot of water in the patient's mouth. So it is for you as a nurse to be taking that away with your suction tube. So that is really important, because it makes it more comfortable for the patient, because if they are lying backwards and they have a lot of water in their mouth or in their throat, they can feel like they're choking. So the idea is that you're in there inconspicuously and you are taking all that liquid away for the patient. Now, there are different ways of doing it. You know, the dentist controls everything and you just have the aspirator. I've worked in lots of different practices, but I worked in a 4-handed dental practice where the nurse has the 3-in-1 syringe, which a 3-in-1 syringe is the air and water thing that a dentist has. So when you work 4-handedly, you have an aspirator and you have a 3-in-1 syringe. The dentist has the drill and a 3-in-1. So you're kind of working both together. So that means that the nurse can wash and dry the tooth while the dentist is doing something else. So you're thinking ahead of what the dentist needs before the dentist asks for it. So you kind of know what the treatment is. So you're mixing and you're preempting. And, you know, I've worked with dentists that call things the wrong thing. But as long as you pass them the right thing, and, you know, I've worked with dentists that call things completely the wrong thing. There's an instrument called a Mitchell's trimmer, and I used to work with a dentist that called it beaky spoon. Now, if you see a picture of a Mitchell's trimmer, you will know why it was called beaky spoon, because it beat one end to spoon the other, beaky spoon. So she always got that. So there's that. As I say, you're disinfecting the surgery after the patient has gone, so you're looking at the cross-infection measures, and you're just making sure that everything is running smoothly, that you're not going, oh my goodness, I haven't got that, and having to run off and find it from another surgery. You're also looking at the lab work, so if you see on your patient list you've got something that, you know, say a denture or crowns or bridges or whatever, you need to make sure that that laboratory work is back from the laboratory when the patient is in the chair. So all of these things, stock control, refreshing, making sure that everything is filled up and done. So it's a complex job that doesn't always get the praise and recognition that it needs. And it's a shame. It's such a shame, because it is a great career. It's lasted me a long time, and I've enjoyed every minute. And you're working towards a qualification, so you can go in as an apprentice, and you work towards your qualification as a dental nurse. You then register with the General Dental Council, so you are a registered dental nurse. You can then go on to other further education, so you can get a certificate in radiography, so you can take x-rays, you can do oral health educator, which makes you an oral health practitioner, which I did several years after I did my dental nursing. There were so many more, application of fluoride, taking impressions. There's lots of extra things you can do, and also if you want to, you can go on to train as a hygiene therapist if you wanted to, so you go to university, which is great. I mean, you've got a really good career,
good solid footing,
and you've got a career progression if you want to. We have to do things like CPD, so continued professional development. We have a target of that, a 5-year cycle that we have to do a certain amount, and there's course subjects that you have to do. So you have to keep your training up to date, you have to prove that you've done that. So it's much more of a job than, I think if you said to a patient, what does a dental nurse do? They probably wouldn't be able to tell you, because we're almost like there in the background, making things seem seamless. So we're like the duck, us with the legs underneath to make the duck go smoothly across.
I like that analogy. That's a good one.
Well, it's funny, because I think that we're kind of lesser known in the dental field, because I remember my friend saying to me, oh, you're quite knowledgeable. Do you know what? You could be a proper nurse if you wanted to.
What a cheek.
Which I kind of thought, okay. I don't want to be looking at other parts of people's bodies. I'm interested in, the mouth, the holistic approach of prevention and that kind of thing, which has led me to my career. And that's what I do. That's what I enjoy doing. And so that, when you think of a dental nurse, you don't literally have to spend the whole of your working life in a surgery. You don't, because there are other progressions that you can go on to. So it is an exciting career, and it's really interesting.
It sounds it. It really does sound it. Because I think before I knew more about the profession in general, if you had have asked me what a dental nurse does, I would have said, well, they kind of sit on the computer and type things when the dentist says stuff. And that's it.
Yeah.
I wouldn't have known the amount of things that you can do. And
to be honest, a good dental nurse, the dentist really doesn't need to actually say anything to them. That, you know, when I was nursing, I would always say, you know, if the dentist was doing something else, I would check in with the patient that they were okay, that they were feeling fine, that, you know, kind of, I'm on your side, mate. You know, because nobody is in their kind of element really being in the dental chair, because there is a degree, even if you're not sort of dental phobic, there is a degree of anxiety.
Definitely.
And I think it's nice for them to know that somebody's on their side. And I always say, you know, if somebody says to me, I don't really understand the treatment, I don't really, ask the dental nurse to explain it to you. They're worried about asking the dentist because they think that the dentist is going to think they're a bit stupid. Ask your dental nurse, they'll know.
Yeah, and they can explain it to you.
Yeah, they'll explain it to you in words that you'll understand without great big jargon. But they will know. They'll know as much as the dentist because they've seen your x-ray. They can't prescribe, they can't diagnose, but they'll have seen it and they'll have enough experience to know what's going on there. So they can chat to you about your situation and, you know, give you advice on toothbrushes. It's endless, really, what you can do.
Well, at the risk of making another comparison to being a quote-unquote proper nurse, it is a bit like nurses and doctors, where the nurses know all the stuff. They can't do the bits that a doctor can. It seems like it's quite similar.
It is very similar. I mean, we're just like specialised nurses, really. I mean, we're kind of like from the chin to the top of the nose, really. But you know, it is a more we just specialise on that bit. But that not saying that in the training you do anatomy and physiology. You do learn about the rest of the body, obviously. But you know, you learn predominantly about teeth, and sometimes now somebody will say something and I think, gosh, that rings a bell. And then when you've learnt all the muscles and all the nerve supply and all the bones in the face and the head, and you think, oh, yes, it's a lot to remember.
Yeah.
But I think the rewards outweigh it. I mean, you know, it's not the best paid job in the world, but you get a lot of job satisfaction. And as I say, you can work your way up. You don't have to spend all of your time in a surgery. So, you know, there are different options should you want to be. It's a great job if you want to work part-time. You know, you can fit it in around. And, you know, that's been a flexible option. So
that's brilliant.
And I think everybody should have a go at it.
Yeah, why not? Well, thank you, Karen. That's been really, really interesting and insightful, and I hope that you've learned a lot as well.